Hi everyone, and thank you so much for joining our webinar today, where we're going to be discussing the impact of COVID-19 on children and their development. I'm Hannah from Satchel, and I'll be joined by special guests sharing how COVID-19 has affected the education, the social and emotional development, and the health of our children. Today we'll be hearing from Mr. Naimish Gohil, founder and CEO of Team Satchel, Mr. Patel, Assistant Vice Principal at Blue Coat Church of England Academy, Walsall, Professor David Rawich, Head of Paediatrics at Cambridge University, Dr. Nazima Pathan, a clinical researcher at Cambridge University in the field of paediatric intensive care, and Dr. Ela Chakrapani, Consultant Senior Lecturer in Neonatology at the University of Bristol. Thank you so much to all of our panellists for being with us and giving their time and expertise today. You may be aware that Satchel recently started our very first charity partnership, and we are so excited to be supporting Action Medical Research for Children, who have partnered with us to provide this session today. For anyone who isn't familiar with Satchel or Action Medical Research, I would love to give you a little bit of background about both. So, Satchel is the UK's #1 learning platform used in schools, providing classroom management tools and supporting students and parents to be better engaged in their child's school life. During the pandemic, we've been working to optimise and adapt our platform to facilitate remote learning and have been tirelessly developing our tools that promote positive learning environment for all. Action Medical Research is a charity that has been protecting children for nearly 70 years, funding vital research to help defeat the diseases that devastate the lives of sick and disabled babies, children, and young people. Today, they continue to tackle the challenges that disease and disability present by funding high-quality research to save and change children's lives. Right now, there are lots of unanswered questions about how COVID-19 and the pandemic affect children. So Action is driving forward research to really tackle these big issues. We at Satchel are so proud to be working alongside Action to provide positive change in the lives of children. So, our first speaker is Satchel founder and CEO and former assistant head teacher, Naimish Gohil, who will be sharing his experience of the impact that school closures, Our first speaker is Satchel founder and CEO and former assistant head teacher, Naimish Gohil. He'll be sharing his experience of the impact that COVID-19 has had in education and the challenges facing students as a result of school closures. Hello. Hi, Naimish, are you well?
Hi, Hannah. Yeah, I'm very well. How are you doing?
I'm marvellous, thank you. Lovely to see you. Are you ready to make a start?
I am. Thank you.
Fantastic.
Great. Well, it's great to be here. Thank you, Hannah, for passing it over. My name's Naimish. I'm the founder and the CEO at Satchel. We've recently partnered with Action Medical Research. We're thrilled to be supporting them on their mission and the important work they're doing in investing and raising money supporting medical research for young people, particularly with COVID-19. We know how important that is and the lack of research that's out there at the moment. At Satchel, we make software for schools. Our mission really is to empower teachers, students, and parents with the best products and services they need on their journey through education. Prior to founding the business, I was actually a classroom teacher for a number of years, and then I became an assistant head teacher. And that was really what provided the inspiration and the idea to start the company. Today, Satchel is used by 1 in 3 secondary schools in the UK. We have thousands of schools all around the world, but we're fortunate to play an important role supporting a lot of schools here in the UK, and particularly through the pandemic, that proved to be really, really important. I wanted to just share a couple of slides on some of the things that we've been seeing over the last kind of 12 to 18 months, which I hope you may find useful. So, yeah, the pandemic, as we know, has affected all of us, and even more so for teachers, students, and families in a way that none of us could really have predicted. The school closures, the reopenings, the need to quickly adapt and change how we work. These things are all very, very different to a normal school, which is often very structured and routine-like. And so it's really been a huge challenge for everyone involved within the education space. In terms of the work that we've done, as I mentioned, we work with 1 in 3 secondary schools. And if I share some of the snippets that we've seen, then just in the first week alone, when school closures were announced, we had over 1 million students who logged into the product and were using it. And since then, that's been pretty stable. We pretty much have 1 million students on a daily basis who use the product to access their work. At the same time, even in that first week, we had something like over 750,000 tasks and assignments set to students. I think what's really interesting about that, and often is kind of underlooked, is just how quickly teachers adopted technology in a very, very difficult period. I think, you know, our staff in the front line in the NHS did a wonderful job. I think, you know, teachers also deserve a huge amount of kudos for the way they've been able to support students and families up and down the country in a difficult time. We also saw that actually the government made it a requirement to ensure that all schools had some form of distance learning tools. Again, that was something that the pandemic really highlighted, the state of which or the disparity of technology across different schools up and down the country. And so it was great that actually we had real government support to fund and to support drive this initiative. So that was excellent. And then, you know, if I think about just from a student perspective, you know, of course, this increased screen time and all the other things related to it, because we naturally have, you know, students spending much more time in front of a computer. But there was never going to be any worries really about how quickly students could pick up and use these digital tools and services that were in front of them now across all their different subjects. And so, you know, lots of really positive things in that sense. The flip side is, you know, we were not able to walk the corridors or the hallways. And I think those things have been really, really missed. And of course, the net impact of that is lots of other issues and have come to the surface, particularly as we start to come back to some normality, as we're starting to see schools reopen. And if I share a couple of examples that I'd like to just highlight, 3 areas that we're seeing that are quite prominent at the moment are the number of cases that we're seeing in young people related to mental health. Loss of learning has been very well documented, and you know that's something that we just can't get away from. And we're seeing behavioural issues, and so these 3 things have not necessarily been visible up until, you know, we've seen schools reopen. And if I just dive a bit deep into some of these, I'll share some examples. So, for example, this first point around, you know, just, you know, the difficulty of adjusting back into the classroom when students return to school. It wasn't the setting they were familiar with before the pandemic. We now, you know, have bubbles, there's different guidelines, there's social distancing, there's staggered times. These are all very difficult and different things for students to adapt to. We also have in secondary schools, particularly, the reintroduction of kind of authority figures, behavioural expectations that you would see in that you would expect schools to have, which you need. All of these things are we cannot expect to like flick a switch and for these things to just happen overnight. There's going to be some time. It's going to take some adjustments, and actually that needs focus. There's also things around for students having to learn how to socialize again in small groups, in big groups. Again, this is things they haven't really done face to face. They've done digitally through WhatsApp groups and Zoom meetings and so forth, but it's not the same face to face. There's also fears around kind of not feeling safe in school. Of course, this also applies to parents and families who are nervous about maybe sending their kids back to school. Also, if you have children that may have underlying health issues, there's a number of these kind of fears that still exist. And of course, then again, the downside is we know there's lots of research that shows that attendance is critical to have successful outcomes. And so, how do you, that's a complicated challenge for schools. And that challenge varies so differently depending on what part of the country you're in. And then just around the last point around, as we've said before, as I touched on, the emotional and behavioral challenges with mental health that we're seeing. If I just go quickly to mental health, what's been interesting, or what's been really highlighted, is we know that students today, many of them are not used to or experienced with dealing with anxiety or dealing with grief. A lot of young families, young students have lost loved ones over the pandemic, and how do you get that support? When the students have been all remote and at home, a lot of that context may not be aware or to everyone within the education world that supports that child. And so there's a lot of these kind of issues that are really coming to the surface that do need addressing. And then just on the last point, we read a study from the Social and Economic Research Institute, and they did research looking at school closures in England and the impact it had on emotional and behavioural well-being of children. And from the studies, they showed it was material. This was they did a survey that really highlighted actually what impact this had on young people. They also looked at kind of feedback from mothers, and they reported a substantial increase in kind of children's difficulties measured by strengths and difficulties, again through questionnaires that they did. And they also looked at kind of index scores where they measured negative behavior and what it was year on year prior to the pandemic and post-pandemic. And I think some of the studies show that behavioral issues have increased by 14-15%. So if we zoom out, some of this stuff probably isn't going to surprise us. I think as adults, we've faced, we know as adults the challenges COVID has had. So for young people, I can imagine this is 10 times more difficult. If I think about the key takeaways from this, what is really positive to see is there is a real focus now, coming all the way from even Ofsted through to kind of educators, that we have to look beyond grades and assessments. And actually, there's a time and place for that. But before we can do the real work of assessments and grades and stuff, we really need to focus on the whole child. And we need to make sure those social, emotional learning and needs, those mental health challenges. A lot of these things are just not visible, right? Things that are not visible need to really be need a focus and drive from government, charities, companies like Satchel and others who are who need to focus on continuing to raise awareness in this area, and also help, whether that be through services or products or funding or whatever that may be. But that is something that I think really needs attention. And we don't know the impact of COVID on young people as of right now, or we might not know for the next 12 months, the next 24 months. And what is apparent is we do everything we can to support with the research and funding that may be required, and support organizations like Action Medical Research. And that's why we're really proud and supporting the wonderful work that the charity does. And we're excited to see how that progresses. So look, from my side, I appreciate the time. Thank you for joining us today. I'm going to pass it back over to Hannah. We've got you're going to hear more about some of the wonderful work that Action Medical Research does in this particular area, and we also have one of our schools who's going to be talking firsthand about their experience about how the pandemic has affected them and their students. So thank you very much, and Hannah, over to you.
Thank you so much for that, Naimish. That is fab. Would you mind unsharing your screen for me, please?
Sure.
Thank you. So, question time, Naimish.
Sure.
A few things. As a parent, I would love to get your perspective, please. How have you found it working full time and being at home with your children, supporting them through the pandemic at the same time? What's that been like for you?
A challenge.
Yeah, I bet.
Yeah, it's been juggling. It's been a lot of juggling and trying to find the right balance between, how I mean, I've got very young kids, all under 5, so like, how much work can really a 5-year-old do? And that's definitely been challenging, especially with work. But it's one of these things where you just when you get chucked in the deep end, you just have to find a way.
Yeah.
And fortunately, I've had I've been able to get some support, from my bubble with my folks. So that's been helpful.
Brilliant. That's fab. You mentioned that behaviour, loss of learning, and well-being and mental health were the main areas where students have been most deeply affected as a result of distance learning. Do you think that that's going to be a long-term issue that we're going to see, long-term, or do you think that's something that is going to be, we're going to see students working through that fairly quickly? And how do you suggest that schools would tackle those issues? Because they're 3 fairly hefty areas that need attention. How would you suggest to prioritise them when they're so different but so important?
Yeah, no, it's a really good it's a good question, and there's no easy answer. I think if I go back to my prior comment, I think the emphasis of grades needs to be secondary.
Yeah.
For a period of time. I don't know what that period of time looks like, but the most important thing is supporting the whole child, and so their mental health, their all-round well-being, those things really have to take precedence. And so I think as a for my own kids, that's what I'm trying to encourage. The head teacher. That's not always possible because schools always have lots of constraints. But I think some of the decisions the government have made have been positive, and they're also recognizing this. As we know, the latest changes to the Ofsted framework that are coming into place has a real focus on this area. And what's also good is it's not just for the students; it's also for the staff, for the teachers, because we need healthy, energized, engaged teachers who are spending a lot of time with our children. To be motivated and fit and well, so they can do the best for the 25, 30 kids that they support. I think if I summarize, I think there's a real awareness about these areas today from lots of wonderful organizations, and I think that's something that needs to stay front of mind. It can't just fade away. And we need to continue to invest in those areas, particularly for like counselling, social emotional learning support. We hope that the governments and schools keep finding money to get the right resources to help those kids that really need it.
Yeah. Absolutely. And finally, now that teachers are a bit more willing to embrace technology, as you say, we've all been thrown in the deep end, what is one tool that you think that every school should implement that's going to support students' behaviour and well-being, not just right now, but moving forward? What kind of investment would you be recommending?
Yeah, I mean, I really want to say Satchel One, but I know that's going to be biased. I think I don't think it's one tool. I think there's there's really good products and services out there for well-being, for mental health, for counselling, for educating teachers, training. Again, I'm sorry, I can't say just one product out there. But if I may, I would say when they're making that decision, they should really put the child and the student at the center of it. So when they're evaluating any kind of product, how is this going to help? Is this going to help a small proportion of our kids? Is this going to help every kid? And that should be a question that is important to ask when schools are thinking about and evaluating the different kinds of technologies out there.
Yeah. Fantastic. Thank you so much, Naimish. It was lovely to have you with us. Take care. And thank you again.
Thanks, Hannah. Thanks, everyone.
Bye. Thank you so much to Naimish. That was fantastic. So now we're going to hear from Mr. Cam Patel, who is an assistant head at Blue Coat Church of England Academy in Walsall, and who has a special interest in pupil engagement and welfare. Have we got a Cam on the line? Hello. Sure. Just go ahead. We can hear you.
So I've been asked to speak about the impact of the pandemic. Initially, I'd like to give you some context before I talk about the impact it's had on the children at the academy. First of all, the first lockdown, I believe, shocked our pupils. They got so used to coming to school, enjoying the learning environment, the pastoral care, lunch times, even down to the nitty-gritty of the basics of food and breakfast club, which we provide. During the first lockdown, we had a high number of pupils that were vulnerable, and key worker pupils whose parents were key workers, so they attended. And for the first lockdown, we put those pupils together from different year groups, 7 all the way up to 13, and they became like a little family. They would spend their day together with some remote learning, with some puzzles, some games, sharing food, all this whilst we were trying to maintain a social distance and understand the pandemic in its reality. And one of the most difficult things then was those pupils became so accustomed to being in school during half term and even during the Easter break. In July last year, when we said to the pupils there's no longer any provision, they were heartbroken. They almost didn't know where to go, what to do. And I recall during the first lockdown, we worked closely with a local charity that was kind enough to provide us with food bags, breakfast bags that my pastoral team delivered. And I think in total during the lockdown, we did in excess of over 500 bags of food delivered to the homes of certain families. And they were so thankful. It was unbelievable. They really, really were. Those pupils from those multiple year groups are still now friends because what brought them together. So that was really, really nice. What was difficult during the first lockdown was the fact that we had Show My Homework as a platform, but it wasn't embedded at that stage. We were of the thinking at that time last year that our pupils really struggle at home. Is the platform really necessary? So as we move on to the second lockdown, this is where it got even stronger. So we came back in September to a life in bubbles. Each year group was in a separate bubble with social distancing, hand washing, lots of sanitizer, wipes, their own toilets, their own entrances, and they were in the same classroom all day. The curriculum was limited because there was no PE, there was no DT practical lessons, no woodwork, metalwork, no art, textiles. It was really, really upsetting for some of them to be in a classroom with a specialist teacher without the rooms and the specialist resources for them to enjoy the curriculum. However, they did adapt and they came back. So that was where we decided. We looked into different ways of how we could get those pupils happy. We wanted their mental state to be strong. But I just want to go back a second, that these are year 6 pupils that haven't celebrated their prom. They've had no transition from year 6 from a primary environment to a secondary environment. Normally our school would have done visits. I would have been one to visit those little youngsters and said, welcome to the academy. And they would have had 2 induction days. They had none of that. They just came to a life in a year 7 bubble. And to this day, they are still in that bubble. And the same goes for year 11 leavers that did no exams. Luckily, we've got a high retention rate in the 6th form, and they came back to a 6th form bubble, and they still haven't experienced life in a Christian 6th form. They really haven't enjoyed that. So that's something that they haven't enjoyed. They had no prom, they had no celebration, they have had no prize assembly. Even my own son received his certificates through the post, which was a little bit sad. But it's just, again, it's going to go to how those pupils now feel and still the impact of those. Which again leads me to, we're lucky we're a big site and we're very spaced out, and the pupils, they haven't interacted with each other. And we are from a very diverse community where normally siblings would have lunch together, sitting outside. They'd sit in the canteen or on the benches or under a tree. Little communities of even minorities would get together and sit and have a little picnic. We've had none of that. So they've been very isolated in the year groups, which is really, really heartbreaking. It really is. One of the biggest issues was the gap in home learning. Some pupils tried really, really hard in the first lockdown with paper-based resources. Some struggled with paper. They came back with work written on the back of envelopes and bank statements because they just didn't have the resources. But then what we decided early on was to invest in Show My Homework, Satchel One, the platform, and a number of pupils really did enjoy the fact that they could log on and interact with staff via messaging. We took Teams under our wing, Microsoft Teams, and we delivered a lot of live lessons. We were lucky enough to receive DFE laptops and Wi-Fi dongles, which we hand delivered to pupils, and they really enjoyed interacting with us with those. One of the other concerns for us was that the exams were cancelled, yet some schools, in order to award grades, the only thing they did was exams. There was no holistic view, and some of those pupils were put under undue pressure. I mean, some of my own pupils here felt pressure from some subjects where they had to provide holistic evidence to receive those grades. So I've just really rattled through there an operational view of what it's been like for the pupils. There have been one-off incidents. There have been multiple incidents of pupils reporting mental health issues, which brings me to my almost a list. So the question was the impact on pupils of the pandemic. So I think one of the first ones I'd like to mention is we saw them having really, really low self-esteem upon their return, really, really low self-confidence. We had spates of pupils reporting self-harm, pupils, they can't call it mental health because they weren't trained. Now we are, and we can say it. But the campaign, It's Okay Not to Be Okay, was very poignant. Pupils did then realise that, maybe this is a mental health concern, and they could log that. We've had a number of pupils experience bereavement within their family and within their communities. The anxiety of falling behind. We've got a lot of pupils that like to please. Excuse me. They like to please the teachers, they like to please the TAs, and they like to please, but without the resources, they come back full of anxiety and sadness to say that we haven't been able to achieve what we want to achieve. Some pupils felt isolated, the loss of freedom. This is an important one because when they do come to school, they really engage in the PE lessons, running around, exercise. They don't exercise in a solo manner like an adult would go to the gym or go for a jog. So they felt really isolated. And one pupil even said to me, I felt caged. Another issue that we've had is conflict within the home. We've got families with a number of children that share rooms, domestic violence, pupils seeing their parents or carers, and the things that they normally wouldn't see, but not having the avenue of coming to school and speaking to somebody about what they'd witnessed. So a lack of professional adult conversation, a lack of motivation. A lot of pupils used to come and say, what's the point? Is there going to be another lockdown? There's going to be another one, we won't be in again. So in a nutshell, those are the impacts that I've experienced personally at the academy where we are.
Thank you so much, Cam. I don't know if you can hear me.
Hannah, I can't hear you.
That's fine. Just thank you so much for all of that. That is wonderful.
Thank
and
you.
I just think as well how fortunate your students are to have someone that genuinely cares and is invested in their well-being. So thank you so much. I know, I'm sorry that you can't hear me. Oh, I'm so sorry we weren't able to have questions for Cam, but thank you so much for giving us your time this afternoon and for supporting pupils in such a profound way. That is wonderful. Okay, our keynote speaker today is Professor David Rawich, Head of Paediatrics at Cambridge University. Professor Rawich sits on the National Advisory Council for Child Health and Development USA and was elected a Fellow of the Royal Society this year. Professor Rawich's work has particularly focused on genomic technologies to diagnose and treat rare disorders in children, and he has applied principles of developmental neuroscience to better understand brain injury in premature infants, multiple sclerosis, and leukodystrophy also. Professor Rawich will also be joined by his colleagues Dr. Nazima Pathan and Dr. Ila Chakrapani. Before Professor Rawich comes to speak to us, we're going to watch a short video giving us a first-hand account of how COVID-19 has affected a young family.
How has lockdown been for you?
Lockdown has just the worst.
Why?
I just don't like lockdown.
It's been boring.
It's been boring. Sad because I can't see my granddad.
Is that who you miss the most?
And we can't go anywhere.
It's been hard because we're missing our family and friends, and we haven't been able to see lots of the people that support us, like your physiotherapist, the OT, lots of delays in services, and it's a really worrying time because we rely on people to support us to make sure that Sophia is safe, and at the moment we don't have that support.
It is so touching to see Sophia and her mum sharing their experience of how difficult it's been for them during the pandemic, and it absolutely highlights the importance of the work that Action Medical Research are doing. So to give us some more insight into that hugely important work, I am really pleased to welcome Professor David Rawich. Thank you so much for being here. Over to you whenever you're ready.
Thanks very much, Hannah. We saw in that video how children can be impacted by COVID. And what we will be exploring with some of the other panelists is to better understand the nature of COVID and its impact on children. That will help us to counsel families better, and also as teachers, I think, understand what some students may be going through. Now, the messaging around COVID in children, I think, has been a little bit confusing, because we know that adults have been desperately ill with COVID, and the NHS has been hit hard with many admissions to ITU, and sadly many adults have died. We think that children have come out relatively better than adults. Very much fewer of them will develop the severe complications of COVID, bringing them to hospital or having even worse outcomes. But that doesn't take away from the fact that there are some children, there may be some children in your classroom or kids that you may know that have been hit hard. We're starting to understand that there are two ways that COVID can have an impact on children. One will be a long COVID syndrome. This could be a child who acquires COVID in the community, perhaps through the family member who may have gone through an illness that looks like the flu, seems to have resolved, but then days or weeks or months later will start to have symptoms like chronic fatigue, mental health, abdominal complaints, and others. The parents know they're just not right. The teachers will also see this. And now we're trying to put this together. Can we now explain why children have been affected, from a distant COVID infection? How long will that last? Will it be months or years? So we can better counsel those families and those children and their physicians to provide the right services to support them as best we can. We're at a learning phase, but we are starting to appreciate that long COVID can have a severe impact in children. There are also children that will have much more severe reaction to COVID, and that will drive them to hospital. They can become sick with the initial phase of COVID, or they can also develop what we call a post-inflammatory syndrome, which can affect the working of the heart or the lungs, and this can occur weeks after the initial COVID infection. And then sadly, there are some children who will die. We need to understand the basis for the vulnerabilities that some children have to COVID, how we can better help them build resilience so that they can withstand the infection. We think vaccines very likely will help with that, but that's another research question. And what I'm trying to give you a sense for is that there are these open questions, and one of the jobs of university researchers like myself and the other panels that you'll be hearing from is to better understand the impact of COVID on children. And with that, I think I will hand off and introduce the other panel members who will be giving us their insights. Now, these are projects that we have chosen. They are funded by Action Medical Research, so it'll give you a sense for the impact that Action, is trying to make when it comes to these very difficult and important questions about COVID in children. And so the first of our panelists is Dr. Nazima Pathan, who's a university lecturer and honorary consultant in pediatric critical care at Cambridge University Hospitals and the Department of Pediatrics in the University of Cambridge. Her research group is skilled at profiling the impact of disease on children using biomarkers. And that would be looking at samples of blood or urine or stool for key factors that can indicate how an infection or how a disease has had its impact on children to better predict the outcome, and then ideally come up with better therapies that can be suitable for that child. She has taken an interest in the impact of COVID on children, and her Action Medical Research grant has helped her to further her research and investigation to this problem. So I now would like to hand off to Dr. Pathan.
Thank you very much, David. I'm just grateful to be invited to speak. Thank you. I'm just going to share my presentation. So The subject I've been asked to talk about is the research that we're undertaking to look at how COVID-19 affects children. And we've been working since February to study this issue. Now, you might ask, how does COVID affect children? In the news and in the media, you'll have seen that the vast majority of people who have had severe infection have been adults. And it's true that most children only have a mild reaction when they get exposed to the virus. But they're important to the whole process of how the disease evolves within our communities, because they mix in groups more than adults. So in a way, they are a reservoir that potentially transmits amongst each other, and also, of course, then to the adults in their contact groups. And some children have become sick with the virus, and it's an interesting process where the type of illness is different to adults, whereas in adults the virus seems to largely affect the lungs, making the breathing very difficult. In children, it can present with abdominal pain and vomiting, affect the blood vessels in the heart, present with a rash and conjunctivitis, and affect the immunity. So a much more widespread type of reaction, especially in those who become quite sick. And some of them have needed intensive care, but thankfully very few. However, what we don't know, and one of the things that we need to better understand, is what are the longer term effects of COVID infection, especially in the developing brain of children, and can we do better within the NHS system as it is to try and identify and support those children who are affected, to make sure that both their physical and developmental and psychological needs are met in the longer term, as well as those of their families and their parents and caregivers. So how do we study COVID-19 in children when in each individual hospital? It's quite rare. What we did is that we combined with some of the other big children's hospitals. So I've got a collaboration with Great Ormond Street Hospital in London and Birmingham Children's Hospital, and they are two of the biggest children's hospitals in the country. So between us, we decided we would look at how COVID-19 affects children. And the way we're doing this is looking both at how the children are affected by, as David mentioned, getting samples if children come in, looking at their notes as well, and monitoring them both when they come in and then following them through recovery and after they come home. So the medical notes and the observations that the nurses make at the bedside can give us good ideas on how COVID is different in children, how age affects the pattern of illness, comparing younger children to older teenagers and young adults, and looking at that process of recovery and the issue of potential long COVID in affected children. Seeing if what we know is the virus, the way it gets into the cells, the type of receptor that it uses, largely is present in the lungs, but also in the gut, which is why we think that the gut is one of the sites of infection, of presentation in young children. But looking at breathing, looking at how the infection changes in the upper respiratory tract, and as well as in the lung sputum in those that become very sick and need ventilation. And looking also at the immunity. I mentioned about how the immunity is very activated, and when children get the widespread presentation with lots of different symptoms, it's because their body's driving a hyperimmune reaction. So we want to understand what it is about the virus that sets the cells off. Is there something we could do better to identify that early to prevent that process from going out of control and improve the longer term outcomes in that way? And then, of course, the other thing is we need to know, once you've had the virus, how long are you infective? We know, of course, that you have a period of isolation. There is some potential spreading through both coughing, but also in fecal samples. We don't think that it's active virus, but we need to be sure. So one of the things we're doing is looking at how the virus might spread by looking at children after they go home and asking them if they're willing to give us sputum and swabs after they get home. And as a result of integrating all of that in a child-specific way, and comparing it to data from our adult colleagues, what we hope is that we can identify better suited medicines for children who are affected. But also importantly, luckily with the current pandemic, it didn't affect children. There have been other flu pandemics that have affected children before, and other SARS coronaviruses that might have impacted the younger children age groups more. So we need to be prepared for any future pandemics. So all of this will hopefully give a good understanding of how we can be better prepared for any future risks to our young population. Thank you very much.
Thank you very much, Dr. Pathan. We're going to come around to some questions after our second speaker tells us about his research. Dr. Ella Chakraparty is a consultant senior lecturer in neonatology, and that's the field that takes care of babies at Bristol Medical School. And his research is interested in understanding the impact of preterm birth or hypoxic, that's the lack of oxygen, injury on the developing brain of neonates, but also how events even in the womb can affect brain development. So I think we're going to hear from Dr. Chakraparty the thinking around how COVID could possibly affect the development of the brain in the utero, in utero or in the womb, or just after a baby is born. So I'll hand off to Dr. Chakraparty now. Thank you.
Thanks, Professor Rawich. Thanks for inviting me to share about our work. Our study is called Signpost study. This is looking at the developmental outcomes of babies who are exposed to SARS-CoV-2 infection, either during pregnancy or as a newborn baby. So this is a collaborative work between Bristol, Oxford, Imperial College London, and the University of Leicester, and funded by Action Medical Research. So why do we think SARS-CoV-2, the coronavirus, may impact babies? We know during the pandemic, around 5 per 1,000 pregnant women were hospitalized with coronavirus infection. We know the SARS-CoV-2 has this spike protein, which attaches to the receptor called ACE2 receptor, which is present in the airway cells in the nose and breathing tubes, and that's how they enter the human body. But researchers also found that this receptor is present in the placenta, which is the main organ which looks after the unborn baby, provides nutrition to the baby. And there are studies which have shown that SARS-CoV-2 virus is present in the placenta. It also damages the placenta. And there are viral particles which have been extracted from the amniotic fluid. In addition to that, newborn babies, there are small case reports which show that there are signs of infection, i.e. the antibodies to the SARS-CoV-2 virus have been found in the blood sample of these babies. And we also, from the throat swab, some of the babies were noted to have the virus from the PCR test. So there is some concern that this virus could go through placenta and affect the unborn babies in the womb. We do not know exact mechanisms yet and what extent it can happen in the unborn babies. And there is a possibility that this virus could affect the brain because the unborn baby's brain is fastly developing, and it continues to develop even after birth until 2 to 3 years of age, until school age. So what is the impact of a mother having an infection with SARS-CoV-2 on the fetal brain? And also we know around 1 in 10 women, pregnant women who had this COVID-19, they had high inflammation. Inflammation is a reaction of the body to the infection, and it can present with temperature, and if you have an injury, we have a swelling, redness, and all this stuff. But often inside the body, what happens is there's a surge of white blood cells, substances called cytokines, And all these things could pass through placenta and can affect the fetal brain development as well. So we have two prongs here. One is inflammation, and the other thing is a virus itself. It could potentially affect the brain development of the unborn baby. And what we know, there are several types of coronaviruses. So the other coronaviruses were noted to be neurotropic, meaning they have an affinity towards brain cells. And some of the brain cells do have the ACE2 receptor, which can act as a portal of entry for the SARS-CoV-2. There are some adult studies which have shown the SARS-CoV-2 viral particles in the postmortem brain samples. If you move on to the newborn babies, thankfully, there weren't many newborn babies who had COVID-19 who were positive for SARS-CoV-2, but there were some. And they could get the infection from their mothers or the family members, or they could acquire it from the healthcare workers. And they tend to present with non-specific symptoms, most of them affecting their breathing, and some of them can have temperatures and not feeding well, and so quite a non-specific symptoms. So given this, so there is a possibility that SARS-CoV-2 could affect the brain development of these babies, which could then affect how well these babies are developing physically and also intellectually. So how do we address this knowledge gap? So we could study the brain development of babies who are exposed to coronavirus with advanced brain imaging studies like MRI scan. Or we could actually look at the functional impact of this, study the physical and mental development of babies exposed to coronavirus. But in order to do that, we need to compare their outcomes with babies who are not exposed to coronavirus. And we need a large sample to be absolutely sure if we see any problems with the development, that is true. And also, in order to be absolutely sure that this can be generalized to the whole population, we need to have a population-based sample rather than hospital-based sample. So in the NHS, we had a great system during the pandemic. There are two surveillance platforms which acted immediately when the pandemic started. One is the UCOS, which is UK Obstetric Surveillance Platform, and the other one is British Pediatric Surveillance Unit. So the UCOS, based in Oxford, collected data on pregnant women who were hospitalized with coronavirus infection. So they have their demographics and they have their IDs from all the maternity units in the UK. The BPSU is an established platform which routinely collected information on children with rare diseases. So during the pandemic, they sent emails and letters to the pediatricians around the country and asked them to notify BPSU if there were any newborn babies who were hospitalized with positive coronavirus infection. So those data are held in the University of Oxford. So the signpost team from Bristol will approach alongside Oxford team all the clinical research networks in the NHS, and then provide the IDs of these women and the newborn babies, which can be used by the local doctors and research nurses to find out who these women and parents are, and will send the study pack to the parents. And they will also identify women who did not have coronavirus and the babies did not have coronavirus, closer to the birth of babies who are exposed to coronavirus. And they will be the control group, if you like, and they will be sent our study packs as well. So we are using, because we didn't know how long this pandemic was going on, so we are going to use a parent-reported developmental questionnaire. This is a validated developmental questionnaire, which can be completed online. So the parents, after reading the information, they have an opportunity to ring us or email us about the study so we can explain more about the study, and they can consent to the study online. And once they consented, we will send them the developmental questionnaires, and we can collect the data and we can compare between the babies who are exposed to coronavirus, either during pregnancy or in the newborn period, against babies who are not exposed to coronavirus. So we will be doing this around 2 years of age, so that the developmental assessment at 2 years is quite robust, and that will give us some ideas to see if these babies were affected at all. We'll also look into how often the babies who are exposed are using healthcare and who are all the healthcare specialists they are seeing. So this will give us an idea to see if there has been an impact on the healthcare usage due to the coronavirus infection. So we'll be hoping to finish the study in 18 months. The study has just begun, and we are setting up the site. Thank you.
Thank you very much, Dr. Chakrapani. Thanks both for some very interesting talks. I hope there's some biology teachers out there, because you heard some high-powered biology. And I think, what you should have maybe heard from this is the way that pediatric researchers are now trying to understand, using state-of-the-art tools, how we can better define the impact of COVID on children. We're going to now go to some questions, and actually I'm going to use my chair's prerogative to ask Dr. Chakrapani the first one, because he had mentioned the possibility that COVID could infect the brain of a baby and possibly cause, a problem. Now, there are some viruses that can infect the brain, and they can cause very severe handicaps in children. And I just wanted to clarify with Dr. Chakrapani, does he think there's any evidence so far that COVID causes encephalitis or severe brain infections, or is it more just a theoretical risk that we want to monitor for?
There were some case reports, a couple of cases from France, which has shown white matter changes in the brain in the newborn babies who were exposed to COVID-19, whose mothers were positive, and the babies had positive PCR test and antibodies, and they had punctate white matter lesions. So these are bright spots in the spongy part of the brain, which is really crucial for these babies to develop the future wiring, which connects the different parts of the brain and helps with the intellectual development. So that is one of the evidence which we have. And also, clinically, the babies who have been positive for SARS-CoV-2, some of them were encephalopathic. So there was some clinical evidence suggesting that brain function could have been impacted. But it's quite challenging whether it is a virus which causes it or is it a general illness causes it. And the brain cells, like the astroglial cells, are reported to have this ACE2 receptor. So there's a theoretical risk that the virus, if it gets into the human brain, could potentially affect these cells and modify the brain development. So these are all the reasons why we believe there is a risk, and we need to better understand this.
Okay, great. So if I can paraphrase, there are theoretical risks, and we should really monitor for the possibility. But fortunately, we haven't seen many cases where it's very clear that the virus has had, a severe impact on the brain, at least in terms of, primary infection. But thanks very much. So I think the next question, it's going to be a pair of questions, actually, will be directed to Dr. Patel. And so these are questions now that have come through the survey and from audience members. And the first one really has to do with surveillance. So Nazima, can you tell us how effective are lateral flow tests, and are they safe for children to be taking? Is there any risk of the test itself?
So that's a really interesting question. First of all, to say, what are lateral flow tests? Lateral flow tests are rapid tests that are a little bit like pregnancy tests, where you take the sample, you put a bit of solution to get whatever you're looking for into a solution that you drop onto this module, and then it's going to look. There are antibodies in the unit that are looking for the presence of those molecules, and when it binds, it creates a reaction that creates a line that gives you indication that it's detected the virus. Now, what it needs is lots of virus. So lateral flow tests are not going to be as effective as the PCR test, because what the PCR tests do is they get your sample and they amplify it. So they want to see, it's highly sensitive to see if there's any virus at all. If there is one, it's going to amplify it to get a really strong signal to pick up. whereas a lateral flow test is looking at literally what's there. So it's very useful, particularly in when you've got symptoms, then the likelihood of picking something up and the positivity rate is high. If it's negative, then it doesn't always mean that you haven't got an infection, which is why people are being asked to do repeated tests. And if you do have one, then they usually want to then confirm it with a PCR test in any case. But on a population level, of course, they have the advantage of allowing schools to continue, life to get back to normal. So it is important. In terms of safety, I don't think there's any reason to have any concerns. It's a simple swab-based test, so there shouldn't be any safety risks as such, as long as you follow the instructions with the kit.
Okay, thank you. And the second part of this question is related, and it has to do with where you should be taking the sample, the swab sample from. Is it more accurate when you take it from the back of the throat or from the nose? Or should we be using both or one over the other for the collection of the sample?
Yep. So the gold standard that initially is being done is getting it where we think the virus in adults anyway was getting in, which was right at the back of the nose and nasopharynx. But that's quite an uncomfortable one. And of course, people have been testing different ways, and we need to make sure that they're valid and as good as that. That's the gold standard. It's called the nasopharynx. But what people are doing now is testing both nose swabs, throat swabs, even saliva. What's being used for lateral flow is what seems to be the best is to do throat and then a nose swab. And it doesn't have to be the very back of the nose, but a throat swab combined with a nose swab. The same swab can go first in the throat, then the nose is probably as good as doing a nasopharyngeal swab.
Great, thank you very much. I'm going to hand back to Hannah to ask the next couple of questions.
Thank you. So a couple of questions. Initially, how do different variants of the disease come to be? So we're looking at the Delta variant now. How does that originate, please?
I think this one is for Ella, please.
Yeah, thank you. Thanks, Hannah.
Yes.
The SARS-CoV-2 virus has RNA, which is basically like 30,000 letters. So these letters dictate how the virus develops, the spike protein and the cell wall and stuff. So what happens once this virus enters the human cell, like our cell, and then it starts copying, it starts producing more viruses. And like when we copy a draft and into another draft, we may make some errors in the Word document. And then the same way, when these viruses copy themselves, they will make some errors. And when these errors are called mutations. And when there are loads of viruses with a distinct error, a distinct mutation, and they get established, they're called as variants. Right? And this variant, for example, the first alpha variant was started in the UK, and then the beta variant came in from South Africa, and then there was P1 variant from Brazil, and the recent Delta variant comes from India. So there are variants of concerns, meaning these variants could potentially be more transmissible, moving from one person to another. It could quickly get in. The other key concern we have is whether they could cause serious infection, increasing the hospitalizations, or whether it could escape from the immunity we get from the vaccines. And there are other variants of interest, which means there are certain mutations which may not be problematic. And usually these errors are happening in several letters of this RNA, but sometimes it could be just one letter which could be changed. And that could be that we call as variants of interest, where the scientists closely watch what's going to happen to them.
Very interesting, thank you. So do you think that in future we are inevitably going to come across additional variants then? Is that just to be expected?
Yes, there will be. Unfortunately, this is a survival technique for the viruses, and they will continue to mutate. And some of them will not be challenging to control, and some of them may be. For example, the existing Pfizer vaccine is quite protective against the alpha variant and the beta variant. whereas the AstraZeneca, some of the data shows, is not quite robust against the beta variant. And that's why in South Africa, the rollout was stopped. So, that's an ongoing work. The Delta variant, the studies are still ongoing, seeing how good the vaccines will be in protecting against the Delta variant. So that there'll be ongoing studies going on once new variants come up. And the key is continuing the genomic sequencing of all the new viruses to be ahead of the game.
Okay, next question, and actually this will follow on from what we were just hearing, is to Dr. Patel. Can you comment on the differences between vaccines? Are some more effective than others?
So there's two different main types of vaccine. There's the RNA vaccines, which are delivered in a way where the genetic code, as Ella has just mentioned, which get into the cells, making you produce the virus particles that you will have an immune response. And the AstraZeneca and Moderna vaccines are those types of vaccine. And then there is the AstraZeneca vaccine in this country, which is more based on the actual viral particles. Now, all of them are effective in preventing severe disease. It seems that the RNA vaccines seem to have a reported higher level of preventing any kind of infection. But certainly, as you can see from the numbers, by immunizing people, the cases, although the cases are rising, severe diseases and hospital admissions are much lower than they were, and that is reassuring, and probably due to the vaccine drive.
Okay, thank you very much. And what advice would you give to people who are reluctant to get vaccinated?
So I think it's clear that first of all, of course, the issue of variants that Ella has very nicely described, and the fact that we can only be sure to remove the risk of more dangerous variants coming through if the population is immune. So the fastest way to do that and the safest way is by getting people immunized. And I think it's just about assessing the safety risks. And I think for particularly the older part of the population, it's a given that the risk of the disease is so serious that it's worth having the vaccine.
Okay, and people might also be wondering: are there any people with conditions that you would sort of not advise them to get vaccinated, or is it pretty much a good thing for everybody, even if you had a health condition or even if you have some sort of vulnerability?
I think that that's a difficult one, isn't it? Because I don't want to give a sort of generic thing, because people are also individualized. Obviously, if people have issues with their immunity or chronic diseases, hopefully their hospital consultants and GPs will advise them. But as far as I can see, certainly in this country, the vast majority of people have been incredibly keen to take up the vaccine, even the younger population, because we all want to be able to get our life back on track.
Okay, that's really helpful. One correction I just wanted to make, I think the RNA vaccines, I think Nazima misspoke there, the Pfizer and the Moderna, and the AstraZeneca, of course, is that other kind. I'm sure that's what you meant.
Absolutely, sorry, that's quite right.
So at this point now, we have gone through some of the questions that have been submitted by the audience. I think if panel members had any other, final closing comments, I think maybe I'll just, again, start by saying, we haven't unfortunately provided you with all the answers to the question of how does COVID impact children. This is why we are committed to doing further research to try to understand this. And Action Medical Research is really leading this effort, trying to bring the best in pediatric research to this question. And we know that these answers will be very important for parents and for teachers. And so we are on the job. I'll see if now Dr. Pathan or Dr. Chakrapani had any final closing comments.
No, I'm fine. Thank you, David.
Well, I'm thankful for the Action Medical Research supporting this question, which is really important for many parents. And also it'll help for the NHS to decide how we can protect the pregnant women.
Thank you very much. Hannah, I think we'll hand back to you to conclude the session.
Thank you so much to Professor David Rawich, to Dr. Nazima Pathan and Dr. Ella Chakrapani. Thank you so much for sharing your words of wisdom and your expertise with us. It is so greatly appreciated. Thank you.
Thank you very much.
So thank you all for joining our webinar today. It's been so interesting to hear from our panelists and get a more holistic view of how the pandemic has and will continue to affect our children in the future. If you would like to learn a little bit more about the work that Action Medical Research are doing within the realm of COVID research, please do follow the link in the description box below, and feel free, of course, to donate to their good cause by using our Just Giving page. So thank you all again so much, and until next time, take care. Thank you.